Hello everyone, welcome back. Today I'll be covering regarding a biopsy, a part 1 video. Among my master exam question, I hope this video will help in your exam too. Now let's get started. What is biopsy? It's a gold standard for diagnosing a tumor. The goal of biopsy is to obtain diagnostic tissue while minimizing morbidity, limiting a potential tumor spread, and avoiding the interference with future treatment. The types of biopsy: A. Fine needle biopsy that yield cells for cytology. B. Trucut biopsy that yield small tissue core. C. Junction needle yield large core of tissue. Bone biopsy usage. D. Incisional biopsy yield large samples of tissue. Among the biopsy technique, number 1, fine needle aspiration biopsy or FNAC, fine needle aspiration cytology. The advantage is relatively atraumatic procedure, a low cost and low morbidity. It can be used for local or distant recurrence where the cytology findings can be compared with the prior histology specimens. The disadvantages: the incidence of false negative is high. Even when positive, the diagnosis cannot always be precise. The main limitation is that it does not permit the evaluation of tissue architecture, and in addition, cytologic specimens are not always adequate for ancillary cytogenic, molecular, or immunohistochemical studies. This picture shows the aspiration or fine needle aspiration technique by using an ultrasound probe. The needle is inserted. Underneath, usually taken a fluid collection. Number 2, a core needle biopsy. The false negative rate is lower. It is useful in lesions where the histological study of small sample is sufficient to confirm the clinical imaging appearance. The architecture of tissue is preserved. Thus, it is usually possible not only the histological diagnosis and the grade tumor, but also allows an immunohistochemical or molecular analysis. The advantages are low risk of contamination and minimally invasive procedure for the patient. This picture shows a core needle biopsy example. In core needle biopsy, in deep musculoskeletal tumors, coordination with ultrasound or CT guidance is an easy and safe procedure and can be useful to increase the biopsy accuracy. This kind of biopsy can be performed in an outpatient clinic with the use of local anesthesia, so the cost and the time are less than open biopsy. A disadvantage is a lower rate of accuracy compared with the open biopsy. This figure illustrates the principle of trucut biopsy. There's a needle with a slot for the specimen, and push the needle into the lesion and slide the sheath over the needle to cut the specimen, and withdraw the needle, the sheath, and the specimen is sent for HPE. Appropriate method of biopsy. Again, needle biopsy are appropriate when a small sample of tissue is sufficient to make the diagnosis. usually done in cases of multiple myeloma, metastatic carcinoma, recurrence of neoplasm, or other instances where a small sample is adequate. Needle biopsy are simple, cost-effective, and efficient. If the needle biopsy does not yield the diagnosis, then often the next step is to proceed with open biopsy. This picture illustrates the CT-guided needle biopsy. We are using a CT scan at the left sacral region. The needle is introduced to the osteolytic lesion. Indication for bone biopsy. Diagnostics of bone structural. 2 additional assessment of compositional information at the tissue level. Bone biopsies are indicated in patients with early onset of osteoporosis, renal, malignant disorders, suspicion of osteomalacia, or rare metabolic bone disorder for the analysis of bone mass, cortical and trabecular structure, bone turnover and mineralization, as well as cellular status. What are the principles of biopsy? Complete radiological staging before the biopsy. Thorough pre-biopsy planning, including consultation with the pathologist and radiologist. Determining the most appropriate method of biopsy, whether it is fine needle, core needle, or open surgical biopsy. Placing the biopsy tract appropriately. Make sure the biopsy tract can be removed at the time of resection. Avoiding contamination of uninvolved structures. Avoiding transverse incision. Preventing pathologic fracture. Handling the biopsy tissue appropriately. Please take note. Complication of biopsy. Inadequate, inappropriate, or inaccurate non-representative biopsy leads to poorer outcome in terms of survivorship and limb salvage. It means in patients with inappropriate biopsy, the need to change the treatment to more radical, that is involving the converting of curative to palliative treatment and adjunct radiotherapy in the patient. An incorrect, unplanned incision and biopsy may unnecessarily contaminate uninvolved compartments, which may convert a salvageable limb to amputation. Violating the bone and weakening the cortex may predispose it to pathologic fracture. This figure illustrates an above-knee amputation specimen. Note the transverse scar denoted by the black arrow. An incision biopsy was attempted without imaging and popliteal neurovascular bundle was contaminated with what turned out to be a high-grade sarcoma. This amputation was only because of a badly planned and done procedure. Yay, we have finished the end of the video. See you in the next one. Take care and bye.